If you are sitting alone in your room right now, endlessly scrolling through a glowing screen, your body is under physical distress. Statistically, this exact feeling carries the same mortality risk as smoking 15 cigarettes a day. In 2023, the U.S. Surgeon General, Dr. Vivek Murthy, issued a formal advisory that placed loneliness on the same clinical footing as the most severe infectious diseases and public health threats in America. This chart shows the percentage of people reporting constant loneliness across different age groups. The group with the lowest rate is actually adults over 65, sitting at just 10%. The highest rates belong to young and middle-aged adults between 18 and 44, nearly 30% of whom report feeling severely isolated. When we break that data down further by income, we see a sharp divide. People earning under $30,000 a year report significantly higher rates of severe isolation compared to those in higher income brackets. To understand what is happening here, we have to separate objective social isolation from subjective loneliness. You can live completely off the grid with a low number of daily interactions and be perfectly happy. Loneliness is the painful perceived gap between the social connections you want and the ones you actually have. It is a measurable physical deficiency. You can be surrounded by thousands of people in a bustling city, or have millions of followers online, and still suffer from a lethal lack of genuine connection. For most of human history, surviving meant staying with your tribe. Our brains evolved to reward social cohesion with chemical signals like oxytocin and endorphins. This diagram shows the hypothalamic pituitary adrenal, or HPA, axis. When you are separated from your group, your brain's amygdala perceives a direct mortal threat. It hits the panic button, signaling your adrenal glands to flood your bloodstream with cortisol, the stress hormone, to help you survive in immediate danger. A short burst of cortisol is useful for running from a predator, but chronic, uninterrupted loneliness subjects your body to a continuous flood of it. Eventually, your immune cells become so overwhelmed by this toxic exposure that they shut down their receptors and stop responding entirely, a condition known as glucocorticoid resistance. Without cortisol regulating your immune response, your body enters a slow, chronic inflammatory storm. The clinical results are severe. Isolated individuals face a 29% higher risk of coronary heart disease, a 32% higher risk of stroke, and up to a 50% increased risk of developing dementia. This physiological chaos locks your nervous system into a permanent state of fight or flight. According to Polyvagal theory, a chronic lack of warm, safe human interaction degrades your ability to socially engage. You develop social threat hypervigilance. Because your hijacked brain now perceives everything as a threat, you become highly defensive, pushing away the very social interactions your body desperately needs to heal. Our neurobiology operates exactly the same way it did thousands of years ago. To understand what triggered this widespread inflammatory response today, we have to look at our environment. Starting in the late 20th century, modern society experienced a sharp collapse in what sociologists call social capital. Participation in neighborhood groups, volunteer organizations, and traditional community institutions plummeted, dissolving the networks of mutual trust that historically bound us together. We replaced those community bonds with the achievement society. We are now dominated by an obsession with relentless productivity and excessive positivity. We constantly push ourselves to maximize output, eventually leaving us entirely depleted of the energy required to maintain real human relationships. Digital platforms stepped into that exhausted void. They offer parasocial relationships, one-sided emotional attachments to influencers and digital avatars, as a frictionless, synthetic substitute for actual interaction. The extreme endpoint of this digital illusion is a condition known as Hikikomori. Originally identified in Japan, it involves severe pathological social withdrawal, where individuals retreat entirely into their bedrooms, choosing the hyper-reality of the internet over a physical world that feels too demanding. We have successfully engineered a habitat perfectly designed to biologically starve our nervous systems, all while providing an endless, hollow simulation of connection. This diagram illustrates the immense macroeconomic toll of this crisis. Because of massive drops in workplace engagement and surging medical costs, the global economy bleeds up to $10 trillion, roughly 9% of the global GDP, every single year. personal willpower faces a significant structural barrier. A modern habitat designed for commerce and efficiency often penalizes the very spontaneous human interactions we need to survive. We require massive, immediate structural interventions. That means completely re-engineering our modern urban spaces to prioritize walkability and incidental human contact. And it means our healthcare networks must start treating loneliness as a vital sign, just like blood pressure. But systemic changes take time, and your nervous system needs immediate triage. To exit that defensive fight-or-flight state, your biology requires the physical safety cues of genuine analog human connection. So here is your homework. Bypass the algorithms. Close this app, set your screen down, and make a direct phone call to someone you know. Ask them how they are really doing. Curing this silent epidemic means actively dismantling the illusion of digital connection and reclaiming our ultimate core biological imperative, each other.